George Whitney's family is accusing us of malpractice and wrongful death. Every doctor involved in his care is being sued, including...
Dr. Max Goodwin?
Yes?
You've been served.
Okay, why are you stressed? You're out of here, aren't you?
A patient died and we're being blamed for it.
We didn't do anything wrong. So all we can do now is tell the truth and we're gonna be fine.
Deposition prep isn't about the truth. It's about finding weak spots in our stories so we see how strong the opposition's case is against us.
Thank you, Dr. Optimism.
Hospitals go down because of cases like this.
Dilute 1 vial of antitoxin in 100 cc's normal saline and infuse as a slow IV drip with close hemodynamic monitoring.
Copy that.
Forget the dilution. Push antitoxin in a single IV injection.
So you countermanded Dr. Bloom's order. Then she wasn't at fault for giving an order that was never carried out.
I don't know if we should be assigning blame. I
Did
think...
all 8 patients respond to your treatment, Dr. Goodwin?
All but one.
Would you say the decision to treat with a full dose of antitoxin was made in haste?
Doctors have to make a lot of decisions in haste.
But you weren't there as a doctor. To your own admission, you were there as medical director.
I have to wear multiple hats every day.
Which hat were you wearing when you countermanded Dr. Bloom's order to follow the dilution protocol?
My doctor hat.
But obviously, Nurse Brunstetter saw you as the medical director.
While that may be true, I don't know what affected
Which
their
meant
decision.
that Nurse Brunstetter may have felt unable to contradict
I have
your
no
directive.
idea what Nurse Brunstetter may or
A
may not have
directive
felt.
that may have led to George Whitney's cardiac arrest. From where I sit, because you wear multiple hats, one of your patients died.
No, Max had nothing to do with it. It was a pre-existing condition, most likely exacerbated by the events of the day.
Once you decided an LVAD was necessary, you made a second choice to install it via a full median sternotomy rather than a less invasive catheter-introduced LVAD.
He was unstable and needed immediate help stabilizing his blood pressure, and sternotomy was the fastest way.
So why weren't you able to stabilize Mr. Whitney?
He died on the table.
What was the cause of death?
Embolic stroke.
And what caused the embolism to his brain?
Sometimes they just happen.
You don't think it was because you just performed an incredibly invasive procedure on Mr. Whitney?
No, there are risks for any surgery.
Did you make the decision to go more invasive before or after you learned George Whitney was a white nationalist? I need you to tell me exactly what happened in the OR during George Whitney's LVAD surgery.
Maintain paralysis till his sternotomy closed.
He almost killed 7 people, and now we have to save his life.
Dr. Nottingham, we do not judge the people on this table, we just treat them.
So you realized George Whitney was the perpetrator after you made the decision to perform the more invasive LVAD procedure?
Yes, Dr. Reynolds had already cracked the chest when I saw the tattoo.
None of them caused George Whitney's death.
Oh, that's good to hear.
But if I put any of them on the stand, the plaintiff's attorney will rip them to shreds.
Why?
They all made choices that would appear suspect to a jury. I know this will be a big payout, but to avoid an even bigger one, we need to settle.